Good afternoon, everybody. It's really very nice to see so many of you in a post-lunch session. And Dr. Nikhil, we really enjoyed your talk. Thank you so much for that. I remember after Dr. Nikhil said is that Sadhguru's word that there is nothing like work-life balance. The balance is in the mind. So today we are going to talk about quality, about safety, about surviving in a difficult world, in a rapidly changing environment, with Google-savvy patients and corporate eye hospitals, with NABH accreditation becoming mandatory, with brand building seen as a challenge. We're going to talk about all this and more, and this is an honest attempt from the entrepreneurs, the successful entrepreneurs, the senior NABH assessors, and people who have already done that before, to share this knowledge with people who can take home this message that you can do better, and it is not so difficult to survive as a standalone practice. There are a few quality tips which we will give you today. My talk is on mandatory quality tools. Now this entire presentation which all of us are going to give is a Pecha Kucha presentation. That means all of us will show you 20 slides and give you 20 crisp take-home messages. This is the first time in the history of All India Ophthalmic Society that such a course has been organized, where we are not going to give you too many things, only 20 slides with 20 crisp take-home messages. So I start my presentation with my slide number 1. For any successful organization, a sound housekeeping, the Japanese way, the 5S is a must. That is a mandatory quality tool. So you have to sort out, remove all unnecessary items from your workplace, arrange all necessary items in the correct position, all drawers are labeled, the OT should not look cluttered at all. You should be able to find things when you need it without wasting any time, and shine your workplace. The place should be clean. Even if the doctor is a great surgeon, if the toilet is dirty, I might not want to go to that place again. Bottom line. Standardize the best practices in the work area and see that the patient gets the same experience every time the patient comes to your place. It's not that this receptionist was there, she did a good job. The second one who came was a lousy one. No, everybody has been trained and then trained some more to give the same experience to your patient at every stage. Sustain training and discipline. Obviously, a lot of work will go up front in training, disciplining, and getting your staff ready, but all this work is going to give you 10 times the benefits, or in the terms of patient satisfaction and staff retention. Standard operating procedures. We all are scared of having standard operating procedures. Why are we scared? A hotel front office manual can have 231 SOPs. We as a healthcare organization should get warmed up to the idea of writing SOPs. There is this webinar which I have taken, a 40 minutes webinar, which you can enjoy at your leisure and see how an SOP should be written in the correct way. So all your critical processes in the hospital should have a written SOP. The SOP should be so simple that the next person who is going to implement that particular work can just read the SOP and do it correctly. Now what is this? This is a staff presenting the equipment maintenance and SOP for its use. The staff who is using that particular equipment can make a PPT. Everybody can learn that much, can make a PowerPoint slide and present it. What will be there in that PPT? What is the routine maintenance of the equipment? What is the preventive maintenance? When is the preventive maintenance due in case if you have any such contract? And if there was a breakdown, when was it done, right? And this SOP of exactly how to use, the steps of use, can also be neatly stuck next to the equipment. So if there are small nuances about what not to do and what to do, it's a ready reckoner right there. So take the benefit of checklist. What is a checklist after all? Checklist doesn't allow you to rely only on your memory. You can just read it and implement that. Now, your operation theatre in a small standalone practice, what is the area which you would call a critical area in an eye hospital? Obviously, your operation theatre. In your operation theatre, all your SOP should have the detail is in the devil. The devil is in the detail. Cleanest area first. Which is the cleanest area in the operation theatre? Around the table. Then the innermost corners, then the outer corners and the out. How many of us actually go and stand in the operation theatre when the OT is being cleaned by the housekeeping staff? We don't do that at all. That needs to be standardized, and maybe it's a good idea to put CCTV camera. Now, all the critical processes in the operation theatre should have a process map. This is a part of a lean management also. What exactly goes on the day of the surgery? Task 1, task 2, task 3, task 4, task 5, and in that particular order. We know that if one particular small step is missed out on the day of the surgery, how much havoc that can cause in our lives. Why would we do that? Make a process map, stick it right there, and that's a form of your lean management. The Japanese word of mudas, avoid all mudas possible. What is this? You see this shiny bright car? Now you think everything is hunky-dory? Well, let's see this through this magnifying glass, and you know there is a problem over there. So before there is damage, you intervene. That is what we call it as surveillance in simple language. How do you do surveillance? What is our most important fear in an operation theatre? Hospital infection. Infection, a surgical site infection, and you need to have observational audits. You need to have one nurse who's designated to be your infection control nurse, who will do a systematic audit of every single thing in the operation theatre as a surprise audit or as a routine audit, however you feel according to the load of your work. A mistake is a treasure. Normally when there is an incident in the hospital, something which goes wrong, you would normally do, shh, let's sort of take care of this. No, don't do that. Tackle it correctly, have a corrective action done, but report these incidents, okay? You can learn so much from an incident. This is a Japanese proverb, a mistake is a treasure. You learn from the mistakes so that so many future patients will benefit from the preventive action what you take from this mistake. These are the Ishikawa diagrams, a brainstorming session. You can see here that I'm having a brainstorming session with the staff. Involve the staff at every point. Remember, when a staff leaves you, attrition happens. This attrition is never only about the salary. It's about the salary and low job satisfaction or lack of gratification in the job. So if you involve them in such brainstorming sessions, make them feel important, that they are also an important part of the team. So just like what you see over here, there are two jobs at Toyota: do work and improve work. Involve them in improving work. There are never any big problems. These small problems can be ironed out by changing the DNA and the culture of your organizations. Make a culture of honesty, sincerity, and that starts from, of course, the top boss himself or herself. This is a Kaizen meeting. Kaizen meaning change for good. Small changes for good. And this is a basic idea card where the staff is given a card. The staff writes a problem, does not come to you with a problem, comes to you with the solution, what are the steps of implementation of the solution, and then this results can be verified. And if this new procedure can be standardized, a new solution to a small problem what you have, this staff's name goes in the Kaizen Hall of Fame. How much satisfaction will that bring to your staff? 360-degree appraisal. How many of us actually do 360-degree appraisal? What does 360-degree appraisal mean? It means that when you are actually looking at the staff's performance, you don't ask, or you just don't ask the senior, but the peer of the staff and the junior. Everybody is allowed to opine about that particular staff. So it is a 360-degree appraisal of how the staff works, and make this very transparent. Let the staff know that it's not just my decision to do whatever I'm doing with you, increasing your salary, giving you punitive action, but a 360-degree appraisal which happens. And patient feedback versus experience. This is something which we have done in our center, and we've realized it has given us tremendous benefits. We used to always take this surgery feedback form in this way, like how it is done in the restaurant: excellent, good, average. It didn't really give us anything. Then we decided that all our surgery patients will have a direct feedback which will give us the patient experience. And 5 to 10% of our OPD patients also undergo this direct feedback, which will allow us to improve. How do we learn and how do we improve? Our patients are our customers, and we should directly find out from them if there was something. You know, they might be very happy. In this slip, they would write excellent, excellent, excellent. But when you come and ask them and make them sit in front of you and ask, yes, doctor, everything was fine, but there was this little problem. And that little problem, if you take care, the next 10 patients are going to be very happy. Key performance indicator. So hospital now has become an area where it is the business of everybody, but the responsibility of none. Nobody is responsible. I don't know, it's not my job. Fix that. It's very, very important to fix that. For example, in my operation theatre, when I was operating, people used to move in and out of the operation theatre as if it's Lal Bagh. And I hated that. And I really couldn't do anything about it until the time I fixed this particular indicator. Number of times the OT door is opened after the surgery started, divided by the number of surgeries. So every time a person after the surgery starts, walks out of the operation theatre, has to actually sign on a sheet before they go out. Nobody wanted to do that, and this reduced tremendously. This is a small example of how to make things work. Increase the accountability of surgeon. In our surgeons team, we have a OSCA scoring. We all do self-OSCA scoring. And fix the accountability by having job description and key performance indicators. Monitor outcome. It's important, and this is a newer way of monitoring outcome. You need to leverage technology, leverage mobility. There are mobile phones, and there are now apps available on mobile phones where you can capture all this data about patient satisfaction and data which is required to capture your key performance indicators. I leave you now by these words that I can be only as good as my team. You can be only as good as your team, and the way you talk to your team, the way you converse with your team, exactly in the same way your staff is going to talk to your patients. Remember that. So the respect between you and your team and patients, you and patients, is of paramount importance. That would definitely get you more patients walking into your center. Thank you so much.